NextGenWeb recently traveled to Boston to participate in this year's Connected Health Symposium, held at the Harvard Medical Center. We spoke with several of the speakers and panelists while there, including Jonathan Linkous, Executive Director of the American Telemedicine Association. While at the symposium, John was recognized for his countless contributions and tireless efforts toward building a sustainable e-health industry. This is NextGenWeb.org continuing its coverage from the Center for Connected Health Symposium at the Harvard Medical Center, and we're joined this morning by Jonathan Linkous, who is the Executive Director of the American Telemedicine Association. And John, we really appreciate you joining us today.
Thank you. Good to be here.
So John, take us from where telemedicine started, where we are today, and tell our viewers where's it going in the future.
Well, that's a really big question. Geez, I've been working in telemedicine for 30, maybe 20 years right now, and it's not at all like it was then. It's not at all like it was 5 years ago. It's changing that rapidly. It's expanding. The market is getting deeper, and the market is getting wider. There are applications that we could not have envisioned even 5 years ago. For example, the electronic ICU, where you can do remote monitoring of intensive care units, and that only is an idea that started to work. It's an idea that's now spreading throughout the world as we get more and more of those applications. So we're seeing high-end applications and we're seeing low-end applications. For example, the remote monitoring, that's an interesting idea, but now with cardiac monitoring, we see that as a very aggressive market. Over 1 million patients right now have remote monitoring. In terms of cardiac care, if you have a pacemaker, it's going to be looked at or can be measured remotely by telephone. So it's an amazing market, and it's very hard to predict what's going to happen next.
Now, who stands to benefit the most from healthcare over broadband and high-speed internet?
The consumer. There's no issue about it. The consumer is the one who's going to, because you're going to be able to get healthcare where you couldn't get it before, and you're going to get better healthcare than you can get before. Telemedicine offers not only the type of care you could get in a doctor's office, but better care than you can. You can get monitored on a continuous basis, for example. You can get a lot of services that you could not get otherwise. So it's not just for rural patients. It's for patients or consumers no matter where they live.
Well, John, it's a great symposium, and we know you're moderating a panel later today. We're looking forward to that, and we appreciate your time today.
Thank you very much. Appreciate it.
Thank you very much. Okay. This is NextGenWeb.org continuing its coverage from the Center for Connected Health Symposium at the Harvard Medical School.